So there we go. The numbers are going up now. So welcome everyone. I'm just going to wait for the numbers to go up a little bit more and then we'll introduce everything and get things started. Perfect. So good afternoon and welcome to your Benco webinar. Gateway 2021, Crossing the Bridge into Dentistry. My name is Kay Huff and I will be your Benco host for today. On today's webinar, we're going to be giving you some information about the different reusable masks so that you and your team can make an educated decision on what's best for your practice. So with that said, let's get started. I want to go over a few of the CE guidelines. Number one, you will be receiving 1 hour of CE as long as you're on for the entire program. You must sign in your legal name. What I mean by that is the name that's on your license, because that's what's going to be on your CE certificate. So please make sure you sign in with your legal name. Each person must also sign in on their own computer so that we can see that you're on. You can't watch it together. If you want CEs, you'll need to sign on your own computer. If you're absolutely watching it on your cell phone, that's fine as long as you push the link. However, if you've dialed in, we can only see your phone number. So it's going to be really important that you send me your name, your telephone number, and the title of today's course to practicecoaching@benco.com. Again, that email is practicecoaching@benco.com. At the end, everyone will receive a survey. Please make sure you take the time to fill that survey out. We at Benco want to know what you want to see more of. What do you need help with? We're here to give you that information. So please, on that survey, give us some information on what you would like to see in the future. Also, on the very bottom, you're going to notice there's a Q&A button. The Benco team is super excited to answer your questions. They're going to be on here live. Please make sure during the presentation that you type those questions in the Q&A. And then at the end, the Benco team's all going to come back on and answer the Q&A live. Also, at the end of the webinar, everyone will receive some information and also a copy of the Q&A. So again, please make sure you type those questions in. So with all that being said, I'm honored to introduce one of the most outstanding leaders in dentistry today, someone who I totally enjoy working with, one of the managing directors at Benco Dental, Chuck Cohen.
Thank you very much, Kay. You'll notice, everybody, that I'm wearing a non-reusable mask this evening. It's on my way of saying we all at Benco and in the dental industry in general feel your pain from having to wear a mask all day long. This is only a level 1 mask. You're really supposed to wear an N95 mask when you're practicing, and we understand that these things are difficult these days, given the pandemic and the air quality issues. So we're really pleased this evening to bring to you a program with our experts, our internal experts at Benco, who are going to be walking through the 3 most prominent PAPRs or reusable masks. There are 3 that they're going to feature this evening. They're going to show you how they work. They're going to tell you why reusable masks might be a better option for you and your team members. And with that, I will be happy to turn things over to Sue Evans and Wendy Miller. They are Benco's 2 directors of supply chain. Wendy oversees merchandise and marketing of merchandise, and Sue oversees our equipment. So between these 2 ladies, they're going to introduce some people on their team, and we're very happy to walk you through our reusable mask inventory this evening. Ladies, take it away.
Thank you. Hi, I'm Wendy Miller, and I'm very privileged to be with you today. So as you know, our topic tonight is reusable masks. And you might say, why reusable masks tonight? And Chuck touched on it. N95s are now in ample supply. You can also purchase ample level 3 and level 2 masks. So why talk about reusable masks? Well, one of the things that we're hearing a lot of is that many of you are experiencing side effects from wearing the N95 masks all day. You may feel fatigue, experiencing headaches, dermatology issues, impaired vision and communication, even some reports of impaired cognition. Then there are the environmental concerns, right? We're throwing all those masks in the trash. And then finally, just overall respiratory health issues. And so there are many things you can do to combat those sorts of side effects, and you should do those. You stay hydrated, get plenty of rest, use appropriate skincare, take frequent breaks. Now, when I say take frequent breaks, we know in your busy practices that is not always practical. And so therefore, the reusable mask becomes a great option. On that note, I'm going to turn it over to my colleague Sue Evans, and then we're going to jump right into the interviews with our product managers and the manufacturers of the masks. Sue?
Thank you, Wendy. You are all on the front lines every day, and you may have experienced some of the side effects that Wendy just mentioned. Today, with some of the Benco experts and experts from the manufacturers, we will be reviewing 3 reusable mask options available for anyone working in the dental office. The 3 options can be a great alternative to N95s and even level 3 and 2 masks. The 3 alternative masks we will discuss today are the Gentex PAPR, or as some call it PAPR, meaning the Powered Air Purifying Respirator, the Armor Clara mask, and the Clean Space Halo mask. These reusable masks can be an alternative to N95s. They can be used by the dental team in rotation with their N95s or in place of an N95, whatever works best for the individual or the length of the procedure or the environment. These videos, along with FAQ and additional product detail sheets, will be available and sent to all the attendees after the event. Now I would like to introduce to you Amanda Jameson and her interview with David from Gentex to learn more about the Gentex PAPR. Thank you.
Hello and welcome. Today I have David from Gentex with us, and he's here to talk to us about the PureFlow 3000 PAPR. Hi, David. Nice to see you again.
Hi, Amanda. Thank you. And hi, everyone. David Austin with Gentex Corporation. I'm the business development manager for the PureFlow 3000 product line. My specialty verticals are dental, healthcare, pharmaceutical, and laboratories. Gentex entered into the PAPR market with the initial entry of the ESM Plus version, prior version of these PAPRs. So over the last 15 years, we've been heavily into the PAPR market. And just prior to COVID, end of last year, we introduced the PureFlow 3000 product line, which we'll talk to you about today.
Thanks, David. That was great. If you can you please describe the Gentex PureFlow in a sentence?
Yes. The PureFlow 3000 is a head-borne or head-mounted PAPR, powered air purifying respirator. It brings in air, filters it through a Hepa filter, and provides that fresh air to the worker.
Great. And what would you say is the most unique feature of your product?
The most unique feature of our product is the head-borne design. There are no belts, no hoses, no battery cables, and basically no snag hazards. So working in close environments with other individuals, with equipment, tables, all types of equipment around you, there's a lot less chance of snagging your breathing hose or your respirator in a traditional PAPR versus a head-borne type design.
So what would the advantage be to using your product over a traditional disposable N95?
One of the key advantages is the cost of ownership. We use much less pieces and parts. We have basically a visor, a headband, a HEPA filter, and a battery.
Great. Can you show us how to put it on?
Yeah. So one unique aspect of the PureFlow 3000 is it is ready to go right out of the box. So when a worker opens up the box, the unit's in there. We supply 2 batteries with the unit and a HEPA filter, so everything is there for them to actually put the unit on and go right to work once they've had the proper training and so forth. All it requires is putting the HEPA filter on. Little simple step there. Inserting the battery and turn the unit on. On and off switch is right there. Make the adjustment in the back, And there we have it. I'm breathing good, fresh air.
So would the patient be protected while you're wearing that?
Yes. So the design, the way the air flows through the respirator, it's being pulled in from pulled in through the HEPA filter, forced up through this plenum in the top of the respirator, just a tube, and then the air exits right in the front, right around the brow area here. That constant flow of air flows across the visor, and it's circled. It's what we call the breathing zone. And as the worker consumes the air and exhales, the pressure inside, basically pressure inside of this breathing zone, right in the face area, pushes the excess air out through around the headband area. Depending on the size of the head and individual, it can come out in different places, but it's all around the top here. So the excess air is being pushed out in this direction. But definitely the patient is protected. All of the air inside here that we're breathing and consuming is being pulled in through the HEPA filter.
So if I'm in a dental office, who would you recommend would be best suited to wear a PAPR? Would it be the front desk, the dental hygienist, the dental assistant, the dentist, everyone? Who do you think is the best fit?
Depending on the situation, front desk, not so much, but certainly anyone who is having close interaction with the patient or with other individuals within the in the office there should or is a candidate for wearing a PAPR.
Are there any scenarios within the dental practice that you would not advise to wear a PAPR?
The only thing I can think of in a dental setting is if especially the visor here, if any of the instruments or lights that are being used could hinder the use of a PAPR, or the PAPR could hinder the use of that item.
So can you wear eyewear or loops with lights while you're wearing that unit?
Yes, if the loop will fit, and that's what I was grasping for a second ago and just couldn't find it. The visor style, we have two styles that are popular. This is the same respirator. What we do here is, instead of having the clear visor, this unit uses a hood, and I've got one behind me if you want to see that. But this has a hood that covers the entire respirator, comes down to the chest area of the worker. So that allows for more room in the face area. So some of the loops will fit under it, but it's just a matter of the spacing that we have between, and everyone's head is a different size, but depending on the person and the device that's being used, it allows for a couple of inches to work with inside of this respirator, and then a little bit more room for the loops and so forth. Now, spectacles are fine to wear with any of our models. There's plenty of room to get the prescription eyewear on. Safety glasses are not required if any of that is needed in a dental setting. This visor here is a ANSI approved impact resistant visor. So it's the same thing as wearing safety glasses or goggles.
So how does someone determine if the unit will fit them?
So that's a very good question. We have an adjustable headband, and there's plenty of room to fit the vast majority. We do find that it's on the larger size individuals mostly. We do find one in about 2,500 people can't wear the respirator because of their head size, but don't run into it very often.
So it's one size fits most with the adjustable in the back. Do you need to have a fit test for that unit? No fit testing is required. The other thing that you asked and I failed to answer was beards and facial hair. Because this is a positive pressure respirator,
We're constantly forcing air in, and then air escapes through the path of least resistance. It doesn't require a tight seal around the face or the nose and the mouth area. So therefore, fit testing is not required.
Is this unit Niosh approved?
Yes, all of our equipment, all of our respirators are Niosh approved.
So looking at the unit, are there any ancillary pieces that will need to be replaced? And if so, how often?
Yeah, the biggest question I get is on the Hepa filter. The Hepa filter in a dental setting is going to last quite a long time, a year, maybe several years, because a dental environment is not going to have the airborne hazards that we see in other applications. There's not a lot of dust and dirt and silica and particulates, very clean work environment. So the material is not going to load or clog the filter.
Are the filters the only thing that needs to be replaced?
No. So in a dental setting, filter is going to last you however you want to work the program, but months to a year or two. The headband is replaceable. It's not something you're going to replace all the time. The foam padding in the suspension and the headband is all replaceable. We have in this model, we have the black reusable face seal. This is a Dartex material. It's just a poly-coated material, so it does clean and disinfect fairly easily. These would be replaceable at some point, but they should last you months and months. We have other options that are more disposable, like a Tyvek, a white Tyvek face seal. If you go that route, that's something that you would want to replace after a number of uses. It could be 10, 20, 30. And then, everything on the respirator is replaceable, the visor, but in your environment, you shouldn't be tearing up the equipment. And then if I can, I'll touch on the battery real quickly. It may be another question down the list there, but the battery, these batteries will last several years. They, like most lithium ion batteries out there, like your cell phones and so forth, are rated for 500 cycles. So the battery manufacturer says these batteries are good for 500 cycles. A cycle is a charge and a use, charge and use. But that's the minimum threshold. So if you figure you use this thing 8 hours a day, 5 days a week, which is hard to do, but can be done, it should last you a year and a half, 2 years, 3, and we expect it to last a little bit longer than that.
If I was interested, can the shield be removed, or is that always one piece?
To swap out to swap out a frame or to add a frame to a respirator such as this, there's just a little C-clip here and a C-clip on this side. And once you pull that out, these pegs come out and you can take one off or you can put a visor on. Very simple design, yeah.
Perfect. Can multiple people share a PAPR? If somebody wanted to just buy one to have one in the office, can multiple people share it, or is that not recommended?
But for the most part, it works well if you want to buy a unit or two and have it shared between workers. I would suggest buying a complete unit and then buying additional headbands. So if you have your personal headband, you can walk up, take the respirator off the shelf, put your headband in, go to work. Once you're done, do a good cleaning, remove your headband, do a good cleaning.
Well, my next question is actually, how do you clean it?
The bleach solutions that everybody's using, any of the alcohol wipes, as long as they're 70% or higher, and PDI, all your name brand towelettes and wipes and so forth are perfectly fine to use. Because we have electronics in this respirator, we don't recommend spraying solution onto the respirator or soaking it, dipping it in water. All that's really necessary is a towelette, or take your spray onto a microfiber towel, and then do your cleaning. We have, with the respirator in the box, there's 3 cleaning plugs These cleaning plugs come with the respirator. It's not mandatory, but these 3 plugs will plug up the, if I can get it in there, the battery area, the inlet where the filter is located, and the exit here where the air is forced down into the breathing zone. Those will help you keep the liquids from getting in and possibly getting on the electronics.
Does the unit have a warranty?
Yes, 1-year warranty, bumper to bumper.
And is there any training or support available for people who purchase this?
Yes, we have, depending on the model, we have a couple of training videos. Our training videos take the worker through the manual, basically. So short of reading the manual, you can go right to the video. We've got a 9-minute video, and then there's a 15-minute video that really takes the user through opening up the box. But again, it's a very simple design. It's almost just everything is laid out right there. You just have to make sure you got the battery, the filter on, and turn the unit on, and then it's working. But yes, we have me. I can do training sessions, and hopefully soon we'll be doing those back in person again. But we have spec sheets, we have videos, we have the manual, and a number of different ways to get the training done.
Well, thank you so much, David. I really appreciate your time today and all the information you've shared with us.
Absolutely. Thank you very much for having me.
Thanks, Amanda. That was great. And now we're going to move on to our very own Elizabeth Warwick interviewing the manufacturers of both the Clara mask and the Halo mask.
Hi, good evening, everyone. Thanks so much for joining us. My name is Elizabeth Warwick. I'm a product manager at Benco Dental, and I'm joined this evening by Cherie Lipensky, owner and CEO of Armor Respiration. Hi, Cherie. How are you this evening?
Hi, Elizabeth. I'm excellent. Thanks for having me. I'm really excited to be here.
Thanks for joining us. So now, Cherie, can you please tell us a little bit about Armor Respiration?
Sure. Armor Respiration is a medical device company. We're a startup. We were founded in March of 2020 with really a strong mission of helping with the pandemic. Our mission is to create a product that helps us breathe easier, you're safer, and you're comfortable all day long in what you're wearing. So we have really a strong mission around sustainability, COVID, improving our breathing, decreasing our exposure and protecting against dental hazards. So there's really a lot of purpose in this new company, Armor Respiration, that I'm really proud to be a co-founder of.
Well, wonderful. It sounds exciting. So we're here to learn about the Clara. Can you describe it in one sentence?
One sentence is hard, but I will try. So Clara is a professional grade personal air purification system. I know that's a big word, but it has a clear mask and a wearable filtration unit with Hepa filters.
Wonderful. So what is the most unique feature of the Clara?
I'd have to say the cross ventilation. So Clara protects both the inhale and the exhale. It has especially patent pending valves that control the airflow in and out of the mask. So every breath is clean, filtered, fresh air. Most importantly, there's no CO2 buildup. You can literally feel the air coming across your face. So there's nothing that's building up in there. That's, I think, one of the biggest drawbacks, frankly, of the N95s and most masks. So we're really trying to solve that problem. So I'd say the cross ventilation is probably the most unique feature of our Clara.
Great. So you mentioned the CO2 buildup. What other advantages would you find using your product over a disposable mask like an N95?
Sure. So, one of our big missions for the company is sustainability and really cutting down on disposables. So the fact that our product is completely reusable and it's vastly more comfortable than an N95. It doesn't hurt your ears. We've heard a lot about the ear problems with masks. So this comfortably fits above your ears. It's adjustable, with our straps. The inside of the mask has a comfortable silicone gasket that just kind of floats on your face. So there's a lot of customization to the mask itself compared to, say, an N95. But I'd say the biggest thing is that really, that CO2 buildup is one of our biggest goals, and not having that with that easy cross ventilation air compared to an N95.
Great. So now let me ask you, is the patient protected as well as the professional?
Absolutely. It was really a big part of our company we wanted to stand for. And that is, dentists can now say that we are protecting our dental team as well as the patient. So if you're wearing Clara, your inhale, the air that you're breathing, is protected. And when you're exhaling, that air is also filtrated and protected for the patient. So that kind of dual protection of your inhale and your exhale was really important to us early on, that we can say to our customers that we have your back, you're protected, and now you can say your patients are also protected. You think of an asymptomatic user, we now can say that they're protected as well in their exhale.
Great. So now we've been hearing about the Clara. Would you mind demonstrating it for us?
Not at all. So I'm a former dental assistant many years ago. I'm not going to even tell you, over 20, more than that. So it was really important to me. We're the inventors of this product. It's not sourced out. So this is all developed internally. Everything's made in the US, by the way. That's important. So this little magnet is really easy. You just put it behind the neck. You're good to go. So we know that we want this to be a realistic system for you to use. If you need to go take a break and take a glass of water, you're going to be always wearing your mask on your face. But if you have to put it down there, it's comfortable to go, when you're in a safe area, to have it around your neck there. But check how easy it is to wear with your loupes and eyewear.
One swoop like that. You can tell as I'm talking, it has a voice port. That is a sealed voice port. So no air is coming in here, but you can hear that my voice is a little bit muffled. It has to be, because we're protecting you.
You can see also, this is the second part of it. This is the respirator, as I mentioned to you earlier. This is a very lightweight. It's only about 5 ounces. I'm going to open it up here like this. Everything is clear. We want to be transparent in everything, especially our respiratory health. That was a really big part of it. Here's your Hepa filter. We wanted to use such a wide plane like this, so you're breathing in that quality Hepa filtrated air. And then the back is a belt loop. Belt clip like this. So you can wear this anywhere on your scrub. You can clip it anywhere on the top of your back. You can go in your lab coat. It can go under your PPE, over your PPE. It can go clip onto your belt loop. It's very, very easy, very adoptable to wear for the user. And the hose just connects, the 1-inch hose connects from the filtration unit to the mask. Simple.
Great. Looks super comfy.
Yeah.
So who within the dental practice would be best suited to wear one?
Good question. We have customers that have the front of the house and the back of the house use it. We originally thought it would just be the back of the house, clinical use. But we're finding that both the hygienists, the dental assistants, the hygienists, the dental team in the back of the house, they're all wanting to use it. It's not just for the dentist. Our goal is to protect the entire dental team. We're also seeing some of the front of the house as well. Anyone interacting very closely to patients, when you're really bonding with this clear mask, you can now get close with Clara. You can actually talk to them and they can see your face. So that's a big game changer, I think, in general. But I'd say mostly it's clinical, but I have seen customers that are outfitting their entire staff with Clara. But for sure, everyone clinically on the dental team, from the DAs to the assistants, the hygienist and the dentist.
Okay, great. And I know you mentioned that it was great for eyewear or loupes. Is that in general?
Yes, it was. It's really a very important part when we designed it, the product. And I'm just going to show you real quick. Our instructions for use, our videos, all that good stuff is right in the packaging, a QR code. But you should know that you should wear the mask in the middle part of your nose. It should not go high up, rest high up like an N95. If you wear it correctly, you can wear most loupes, if not all loupes. So I'm going to show you.
You don't want to wear it like this. See how high I am? You want to nestle it down nicely in the middle part of your nose so you can wear your loupes or eyewear.
Great.
So it's very easy. Sorry, it's very easy to wear with loops, but you really want to make sure that you read the directions and actually wear the mask where it should be worn, that mid plane of your nose.
Okay, great. So how would one figure out what size is best for them? They do come in multiple sizes, correct?
They do. Small, medium, and large. We have a sizing kit that's available, on our website. So that will easily tell you. We also are introducing a new app, so that will tell you that you can take a facial scan, and it immediately will tell you if you're small, medium, or large. But right now, that will be ready in about 30 days or so. But right now, it's easy to use with our facial kit that you can see.
Great. And now the other parts of the Clara, is that adjustable as well?
The other parts, yes. So you think about, everything from the straps to the side of the mask, right? So you think about adjusting that. You think about getting that wonderful fit. It's really important that you do that. I'm going to put it right back on. It's really important that you do that because when you're putting on the mask, and you can see the ratchets right here go up or down. This really gets that seal up in the upper nose or the lower chin area. So make sure you do that. You adjust your straps here and here, the neck. And then lastly, what's interesting is the hose management. We put a lot of thought into that. So the hoses actually can be customized. You can cut the hose and actually customize the fit. We all come in all shapes and sizes. So we wanted you to not have to have one size fits all. So you can actually customize the hose length as well.
Great. So now is a fit test required?
So the fit test, it's a great question. So it's important to know that Clara is registered with the FDA as a mask. So you can use it right now, purchase it. We've been approved to sell the mask. We are also going through Niosh testing right now. Upon approval of that, which is any day, we're pending approval, we will be then labeled a respirator. And so as many of you probably know, a respirator does require fit testing. We in our IFU, we suggest fit testing as a mask or a respirator. We think it's really important.
Great. So now, are there any additional pieces to this unit that will need to be replaced? And if so, how often?
So, well, the Hepa filters, as you know, are replaced once a month. The only additional items I would say that we are getting asked about, the inside gasket. So this is a comfortable gasket, as I said. I'd say every 3 months, 3 to 4 months. It's inexpensive, something that that I'm sure the dental team will want to replace every few months, give or take. And then the masks themselves, we always kind of say the 3 rule. You have one in use, one comes in your package, of course, but one is in use, one is being cleaned, one is ready to be used. So that's kind of the 3 rules. So we always encourage customers to order a 2 extra masks for their dental team, or at least have a few handy for the team. So yes, I'd say those are the reusable or the reorderable items that you would have to think about when you're purchasing Clara. But for the most part, when you open up your package, we want to make you feel like you're at Apple computer. Everything in that box, that unveiling, is going to be very special. We put a lot of thought into all the accessories. You've got hose clips in there that can help you clip the hose to your scrubs. So it's the hose management is there. We even have hose sleeves that protect those hoses. So again, I think you'll enjoy such a high quality product because everything's in that box for you.
Wonderful. So can this unit be shared by multiple users within the practice?
We say no, only because, we've developed Clara to be a personalized breathing system. So, it's not to say people won't share it. Things happen, but we just advise against it. It's your air, it's your body, it's your protection. You use it every day, you take care of it, you reuse it every day, you clean it every day. It's adopted and customized for you. The mask is customized for you. You're sizing it for you. So that's why we kind of say no. But again, that's our take on that.
Thank you. So how is the Clara cleaned?
So very simply, Michelle Strange, I always give a shout out. She's our infection control expert. We go everything by what she says. In between patients, we know that we want this to be Clara to be very easily adopted for your office, especially in a very fast-paced office. So in between patients, you can wipe down the outside of the mask very easily, with alcohol or wipe. The inside of the mask, are your germs. So unless it's soiled in there, then you'd wash it with soap and water, because you wouldn't put any kind of alcohol on the inside. You breathe that in, right? So the outside you can just do a wipe down, and then the inside you don't need to touch in between patients unless it's soiled. Now at the end of the day, soap and water, disinfectant, of course, and then let it air dry in the mesh bag that comes in the packaging. So again, very simple. It's not autoclavable like other masks. That's one thing that's important to know, but it's highly easy, highly adoptable to clean, disinfect, and reuse every day.
Great. And now, is there a warranty?
So yes, it was very important for us to think about the warranty for our customers. There's a 6-month warranty on the mask and all those components within the mask, right? And there's a 2-year warranty on the actual respirator, which is the filter housing and any of the hoses. So we've got your back. We wanted to offer a really strong warranty for our customers that use Clara.
Wonderful. And last question. So
Sure.
What training and support is available?
So again, really, really important question. Great questions, by the way, Elizabeth, for anyone watching this. Donning and doffing, adopting Clara was just as important to us as engineering the product, frankly. So there's videos on the website. The minute you open up the package, there's a QR code. There's an IFU. There's everything you can think of that's in that. I personally wrote the IFU. So I know personally that there's a lot of commitment to the use and the adoption of Clara. So I really encourage you to, any user watching this, when you buy Clara, take 15 minutes over coffee and look at the IFU, look at the website, look at our training videos. Michelle Strange did a great video for donning, doffing, and cleaning Clara. Those are all available on our website. And I don't know if I can say the website at this time, but if you'd like to go there, you can. That's at www.breatheclara.com. And that is really to know more about our mission of improving respiratory health. So.
Great. Well, Cherie, thank you so much for joining us this evening and teaching us all about the Clara.
Thank you.
We look forward to learning more.
Thank you, Elizabeth. I'm so excited to be here. Appreciate it.
Thank you. Hi, how are you, John?
I'm well, thank you. Nice to be with you.
Nice. Thank you for being here with us. So if you can, John, can you provide us just a brief overview of CleanSpace?
Yeah, certainly. We're an Australian respiratory manufacturer. So we're based in Sydney. It's where our head office is and it's where we manufacture our product. We've been designing and manufacturing powered air purifying respirators for 10 years now. We sell in over 40 countries around the world. August 2018, we released CleanSpace Halo, which is a powered respiratory device that's been designed specifically for healthcare professionals.
Wonderful. Thank you. So now we're here tonight to learn about the Halo. Can you describe it in one sentence?
It's difficult, but I'll do my best. Halo is a light, simple PAPR that offers maximum protection and comfort with low cost of ownership.
Great. You did a great job. So what would you say is the most unique feature of the Halo?
Look, the most unique thing I think is, apart from the design, which is obviously very different, is how we flow the air. So it's a combination of that airflow, which I'll explain a little bit later on, and this unique, simple design for a PAPR.
Great. So what would be the advantage to using this over, say, a disposable mask like an N95?
Okay, look, N95s, look, fine product and they do a great job, but Halo does offer some definite advantages for those who have had to wear N95s, for long periods of time. Will appreciate that that's a negative pressure product, and when you breathe out, you get a build-up of heat and moisture within the mask, which tends to become quite uncomfortable, tends to fog the glasses, and also there is an effort required to actually pull the air through the N95 filter. Halo takes all of those issues away. Okay, you've got nice fresh air, you've got no breathing resistance at all. It's always slightly pressurized. It will not fog your glasses. And most importantly, it offers a significant increase in protection for the wearer from things like COVID.
Great. So now you mentioned the wearer. Is the patient also protected when the professional is wearing this?
Certainly. So we have an exhalation valve in our mask. Okay, so potentially if you don't fit something to that, what you breathe out could infect the patient. So what we have is what we call our Steri Plus. So contained inside this cover is a filter. Okay, and when it is positioned, and it just simply clips over the exhalation valve. When that's fitted, this now filters anything that the wearer of the device breathes out, and this basically becomes a non-valved respirator. So this will protect the patient.
Great, thank you. So now that we see it, would you mind demonstrating how to wear it?
Yeah, certainly. So as I mentioned, this is a very different device, and if you've seen a traditional PAPR, which is belt-mounted hose to a head top kind of product, you might wonder, well, is this a PAPR? What is this? It is a PAPR, okay? This section would normally be on your belt. So this has got the filter, the battery, the electronics, and the motor. And then we have the mask, and we have a harness, and I've got the Steri Plus fitted to this, okay? It's a very simple device to use. I press the on button, okay? Now, most PAPRs would now be flowing air. This is waiting for me to put it on. It knows when I've got it on, and it knows how much air I need to breathe, and also to make sure that we have a positive pressure or air pressure is out, okay? We actually have a pressure sensor in here that 100 times a second compares the pressure inside the mask and the pressure outside, and it adjusts to make sure the airflow is always coming out, okay? So to put it on, it's very simple. I just separate the mask from the motor. I sit the motor like so, put the mask on and connect it. I breathe. I put on my harness and I adjust it for comfort. Now you can still see my face, you can hear me. I've got movement here, okay? It's not super tight on my face. If you're my patient, I can smile at you. You can see that I'm talking to you. You know, my face is not closed off to the patient. So nice and simple, and I'm filtering what I'm breathing out, so there's absolutely no risk to the patient. Now to remove it, it's simply move the harness forward. I take a breath and pause the motor, and I disconnect it like so. Okay.
Wow. Great, thank you. So who within the dental practice would be best suited for these?
Look, I think anyone that is not socially distanced from the patient. So at the moment, I think with the COVID protocols in place, I think anywhere that someone who's working in a surgery currently wears a respirator of some sort, and that's probably going to be an N95 most likely, then you could use Halo. Halo is basically going to replace those products that you're currently using.
Great. So are there any scenarios that you would not advise using this?
No, not really. So Halo is used widely across many applications from industry. We have industry models which are similar but different. This has been designed, and there are some specific differences for this for the healthcare market. Mm-hmm. But we have this through a huge range of activities, and certainly there's nothing within a dental surgery that you would be participating in that would mean you couldn't wear a Halo.
Great. So now let me ask you, can the doctor wear eyewear or loupes while wearing the Halo?
Yes, they can. So you can see that I've got my prescription glasses on when I put Halo on. We're actually very narrow here in this the nose bridge portion of our mask, and so the loupes are really taking up the same space as my glasses. They're generally extending out. Okay, so look, we have tested Halo with a wide range of loupes. Now, obviously, there's a lot of manufacturers, there's lots of different styles of loupes, and so We haven't necessarily tried them with all loops, but we haven't found any loops yet that we can't fit. So I'm pretty confident in saying you're not going to have a problem with your loops. Just on that, Elizabeth, too, we have tried this with most of the other PPE that you're likely to wear in a dental surgery, like maybe visors, systems as an example, and Halo is very compatible with those products as well.
Great, thank you. So now how will a user know which size will fit them? Are there multiple sizes?
Yes, there are, and that's a great question. And so let me just separate. I'm just going to separate the mask from the motor. Okay. So we have 3 sizes, which is fairly consistent with other respiratory manufacturers and negative pressure products. And so small, medium, and large. This is a medium. Okay. The larger the face piece, the longer the side arms. And so it's a combination of those things to get a right fit. And look, Elizabeth, one thing that we are really big on is training. And, we are very keen to ensure that we're able to offer training to, any dentist who purchases one of our products. And a part of that training is assisting in helping know what size mask you should wear.
Wonderful. So now, aside from the different sizes, is there other adjustable parts to this?
There are. It's very simple. And look, once you've adjusted, most dental surgeries, the mask and the harness are personal issue. We're finding that. It doesn't have to be the case, but generally they're personal issues. So once you've got the right mask and you've made the various adjustments, you don't need to change it. So it's a pretty simple upfront situation. So we have the mask, as I've mentioned. We also have the harness. Now the harness, you can see there's 3 holes here. So we've got adjustment in the harness for head size. We have the strap on the side, okay, which can be lengthened and shortened. And again, we're talking about head size and overall fit of the mask. We have adjustment in the bellows. Okay, you might notice when I put it on, I just adjusted that so that it was comfortable, but I can still move it. Okay, it's not overly tightened. And then we have the little neck support, and they come in 2 sizes. So it's a little counterintuitive, but the one that looks larger is actually the small because it's for smaller head and neck sizes.
Right.
This is for the larger. And then, look, if someone has a larger overall head and neck size, you can actually wear it without the neck support, and they're very simple just to remove and to replace. So there are those adjustments. And again, Elizabeth, that's something we would go over during the training.
Wonderful. So now, is a fit test required for this?
I'm sorry, your voice dropped there. Could you repeat that?
I'm sorry, sure. Is a fit test required?
Look, it is. We're classed as a close-fitting face piece, unfortunately, because our product is not negative pressure, which is really what fit test is aimed at. This is a positive pressure device, okay? So unlike negative pressure, where when you breathe in, you're totally reliant on that seal. And look, something to bear in mind, if your N95 is fogging up your glasses, it means it's leaking. And then when you breathe back in, the air and potentially contaminants coming in the same way. This is positive pressure, so it needs to be fit tested, but we always have a higher pressure inside the mask than outside. Air pressure, any leakage, the air is always coming out. Unfortunately, the standards are quite old, and they're not, the terminology is not such that we get credit for the powered unit that we have on the device. I do apologise. That is something, again, that we can assist with in terms of the training and can help, and it is a very simple thing.
Great. So is this Niosh approved?
It is, yes. All of our products are Niosh approved, including the Steri Plus exhalation filter.
Great. So now you mentioned that. What other pieces may need to be replaced, and if so, how often?
Sure. Look, that's actually a really important question, because when you're considering purchasing something like a powered respirator, there really are 2 costs for you to consider. So there's the cost up front to purchase, but then there's what we call the cost of ownership. And to be honest, the cost of ownership is the real cost of any respiratory product. I would say that there is a cost of ownership to N95s, even though they are disposable. And that cost of ownership is that you go through a lot of them. And so To be honest, if you're using N95s on a regular basis, they are the most expensive respirator you can buy over a 12-month period. There is just no doubt about that. Clean space in relation to other powered devices, we rate very well in terms of cost of ownership, cost to purchase, but also cost to ownership, because there's not a lot of parts. Traditional PAPers tend to have quite a few bits and pieces to them. We have a harness, we have a mask, and we have the neck support. Now, those three pieces we wouldn't class as consumable. They're replaceable. And look, if you can't get 12 months out of those three pieces, at least, we would be very surprised. The mask is a medical grade silicone. This is a long-term product. The filter, which in industrial terms would be considered a consumable, in a dental practice is not. It's designed to block up physically by catching particles. You know, a virus aerosol or a particle is a particle. We physically catch that. But a dental surgery is a clean environment. This is not going to physically block up. So you're going to get a long life out of this filter. So cost of ownership is really low. The Steri Plus, the filter inside here, the case is not, that's reusable. The little filter inside is replaceable, but that is a low cost item. Really, that's the only consumable you're looking at, but it's not an expensive item.
Great. So now let me ask you, can this unit be shared by multiple users within the practice?
Yes, it can. We find typically in most dental surgeries, the mask and the harness are personal issue. The motor is quite often shared, although that's not always the case. Depends on the size of the surgery and how many people are there. But that's generally the way the configuration goes.
Great. So then let me ask you, how is this cleaned?
Very simple to clean. And that's a really important aspect when you're looking at a device like this, especially with COVID, and the disinfection requirements that we have at the moment. The motor unit is very simply wiped over using any approved CDC purple top. That system works well. The bellows stretch out. It's very easy to clean and to wipe over. We actually have a plug system where you can put this under running water if you really need to. And the mask and the harness are simply wiped over and then given a warm soapy water wash and rinse. The only thing we don't do is we don't put them in an autoclave.
Got it. So now, does this have a warranty?
It has a 3-year warranty, which covers the complete unit.
Great. And my last question. So you mentioned the amazing training and support. Can you tell us a little bit more about that?
Yeah, certainly. So as I say, whenever we sell a Halo, we like to train. We're not a company that gives you a product and a user manual and says good luck. We like to invest some time in you and your health. It doesn't take long. We tailor it to kind of try and match the times that fit with dental surgeries, lunchtime, maybe before and after, because we recognise that, dentists are about fixing teeth, not about being trained on our product necessarily. We need about a half an hour of your time, and we will show you how to use it. We'll get you set up. We don't leave it there. We're always available for ongoing support for anyone who purchases a Halo.
Wonderful. Well, John, thank you so much for being here with us tonight and teaching us all about the Halo. And thank you, everyone, for joining us.
It's a pleasure. Thank you. I appreciate your time. Thank you very much.
You.
All right. Thanks so much, Elizabeth. And I think we're going to get started with the questions because we do have a ton of them in here. And I'm going to get started with Miss Elizabeth. For the Clara, how are the hoses attached?
Hi, Reagan. Great question. I happen to have one here, so I'll show you. So depending on the unit, there is a Clara 1 and a Clara 2, so it's either 1 or 2 hoses that are attached here, and also attached then down to the filter. And this is great because the hoses are actually also adjustable. You can cut them to fit your height, so they're completely adjustable as well.
Awesome. Thanks, Elizabeth. Next question, I'm going to pass over to Amanda. Can you use the Gentex PAPR while wearing loops?
Hi, thank you for that question, Reagan. So in regards to loops, you can fit some loops inside. Like David said, you can fit spectacles and loops inside. However, it might be an issue if you're using loops with light. So it's always best to it's hard to really say like a one size fits all answer, but it is possible.
Great, thank you, Amanda. Next question also for Amanda. How easy is it for people to hear you speak through the PAPR?
So as David showed while he was wearing the unit, you may need to speak a little bit louder. So their specifications say that it's about 80 decibels, which if you're putting that into comparison to something, it's around the sound of a vacuum cleaner. So you might need to enunciate a little louder, but the nice thing is they're going to be able to see your mouth. So if you're trying to work with somebody who might have a disability where they rely on lip reading, perfect product for you.
Great. And the next question we have was actually asked on all three of the products. So we'll start with Amanda and then go to Elizabeth for the other two. How much do each of these units weigh?
How much does the Gentex PAPR weigh? So based on that unit, it weighs around 3 pounds. So to put that into perspective, a football helmet is about 5 to 6 pounds. So it's less than that. So you are going to feel it on your head, but the nice thing is that all of your framework for your filters and everything is right there contained on your head. There's no belts or anything that you might get snagged with or anything attached to your belt.
Thanks, Regan. So the Clara and the Halo are both lightweight. The Clara comes in at about 5 ounces and the Halo is about 1 pound. So they're both super easy to wear all day.
Awesome. Thank you, ladies. Next question I'm actually going to pass over to Wendy. Wendy, can Benco help with normal N95 fit testing?
Help with the normal N95 fit testing, and as you heard, some of the masks you saw tonight, the reusable, require fit testing. Benco carries a full stock of fit tests, and many of our territory reps have actually been trained and can help our customers complete the fit test in your office.
Awesome. Thanks, Wendy. Next question also for all three units. So let's go ahead and start with Amanda again and then go to Elizabeth. The question is, how are these units cleaned?
Thank you, Regan. So when it comes to cleaning, I'm going to defer to the instructions for use to really go into the high level on how that can be done. I would really want you to hone in on that and really look at that before I say, but basically just you're wiping it down as David demonstrated in the video.
And for the Halo, that one they really recommend, that you take this off and you can easily wipe this down with a wipe in between patients, and then nightly taking this off and washing the mask part with soap and water. The same with the Halo. So they do recommend, wiping down the outside of it in between patients with a wipe, and then nightly taking apart all the hoses, washing it in soap and water, and air drying them.
Awesome. Thanks so much, ladies. That's all of our questions in the chat. So thank you again for answering those. And just a reminder to all of our viewers out there, we will be sending out an FAQ sheet, which has a ton of information on it for all three units. And some of the questions that you have asked are answered on there. So you can refer to that when you receive it via email. The other thing I will say is for pricing or any kind of additional information or things like that, definitely reach out to our friendly Benco reps out there in the field. They're there for you to ask those kinds of questions too. And with that, I'm going to pass it over to Kay to close us out.
Well, I will say this, guys, you are all so smart, and thank you so much for all your hard work and preparations for putting this together. I know this has been a big deal in the offices because I talk to dentists every day on the phone, and they are struggling with what they can do to help their teams feel better. So I am so proud to be on your team. I wear a heart necklace every time I do these things because, I mean, it's like it's my heart to be able to give all this information out, and we couldn't do it without all your help. So thank you so very much. So Alyssa, do you want to pull up the ending slides? Again, thank you to all you guys that you are amazing. I'm very proud to be on your team, and I love the information that you provided to everyone tonight. I want to make sure that you all know that we have some upcoming webinars. All you'll need to do is take your phone and scan the QR code. We're going to be having 2 webinars every single month. So please make sure that you scan the QR code and sign up for the upcoming webinars. The one webinar that's going to be next is going to be with the pedo practice, because Dental Kids Health Month is coming up. And so we're going to have a pedo. Donna's coming on. Dr. Anna Malecki is going to be coming on and talking about dentistry, feed, speaking and breathing and smiling for children. So you're not going to want to miss that on February the 24th from 7 to 8 p.m. Eastern Time. And then again, we're going to have back, this was a hit a while back. We had Bob on, and he came on and he talked about maintenance, and we've had so much requests for this. So Bob's coming back and he's going to talk about, just things that we need to do to make sure that we maintain our equipment in the office. So please make sure you mark your calendars for that one, because maintaining your equipment will allow it to last a lot longer. That's going to be on March the 10th, which is a Wednesday, from 7 to 8 p.m. So please mark your calendars. I also wanted to make sure I give you one more announcement. You will be receiving your CEs, but please make sure that you know the CEs may take about 4 weeks to receive. So just be patient, they will come. If you have any questions, again, you can reach out to us at practicecoaching@benco.com. So thank you very much. And you will receive the survey with your CEs. So please make sure you fill that survey out and let us know what you think and what we could do moving forward to help you with any questions that you may have going on in your practice. Thank you, guys. Good night.